Hi, everybody. Autism is in the news, and a lot of the topics that are bringing in the news are not necessarily things I think are super important to autism in the years that I have been following the research. But today I have something that I do think is very, very important. There is research that's been going on by a good friend of mine, Dr. Judy Vandewater, that I have been following for over 10 years about the effects of maternal autoantibodies on the developing brain of their children. It's a very interesting topic. It may not be well taken by everyone because it breaks a lot of the boundaries of things that we used to think about autism, and so it's going to be a whole new framework of ways to see this. Like everything, there isn't one cause of autism, and this is not the cause of all cases of autism at all. However, in these situations, the children are usually more profoundly affected, and they oftentimes are affected across multiple siblings within the same family. And this is why it's so important. We think that these type of reactions where the mom has formed these autoantibodies may account for up to 20% of the cases of autism that we're seeing. So it's a pretty significant number. Matter of fact, it's the number one cause that we have been able to identify that's in a large cohort. Other causes would be like Fragile X or 15-DUP or 22q. Those are also really common genetic findings that can be linked with autism, but this is not a genetic finding. You oftentimes hear people in the news say these like kind of flippant phrases that 80% of autism is genetics, and that is not a true statement. But we do see a lot of what we call inheritability with autism, where one child is affected and subsequent siblings are also affected. People for a long time have seen that framework as something that isn't changeable or it's written in your DNA, when there are lots of reasons why siblings could be affected with something that is not written in the genes of their parents. And this is one of those causes. Of course, other causes would be toxin exposures. I think the microbiome is a big part of that. So we have other reasons why we may see sibling affected rates, although this one is the most dramatic. This test is available. We're one of the pilot sites that's going to be offering it to our families. It is a blood test of the mother's antibodies. These antibodies are formed during pregnancy. We think there might be some cases where they happen before pregnancy. And when they are positive in a mom, their offspring are affected like upwards of 97 to 98% of the time, meaning that almost all of their children will exhibit autism, and many of those will be exhibited in more profound ways. This is a really significant component of our autism epidemic, and so I think it's really pivotal for families to know this information. There's a couple ways we can use it. One, many times parents are asking me, like, what happened? What do you think caused this? And they're kind of on a search for a cure. Or an answer, I guess is a better answer. They're on a search for an answer for why their child is delayed or why they may have autism. This is a very clear answer. So the testing is very accurate. And when it's positive, which is not positive in all children with autism, it's a very clear answer. It also helps with future planning for children because once moms have these antibodies, they stay with them. So parents will have a lot more to talk about and details about what that means for subsequent children and what options they have. It's also helpful, which is kind of a new concept with the testing, in that sometimes our families come to us and they say, I'm really concerned that my child may be showing signs of autism at a fairly young age. And those younger kids, 15 months, 18 months, 2 years old, a lot of times we're kind of waiting for their age to kind of catch up, and we're waiting on wait lists to get evaluations to know the answer if that's what's happening. Those early children who develop symptoms very young oftentimes are positive for their mothers are positive for these antibodies. So it also will allow us to identify those children younger, and get services in for them, which is really important for them to get their best developmental services, and kind of put us on a path on what we need to do for those families. It's not that the test would be 100% predictive of exactly how a child will develop and how severe or what their specific characteristics will be, but it will give us an idea that this is a child at risk that we need to be watching very carefully. So the people that are eligible for this test are, the blood is drawn on mothers, and moms who already have one child and they would like to know for family planning reasons what their chances are of having another, they can get this test. Moms can get it drawn on themselves if they have a child that they suspect is showing signs of autism, and I would want you to discuss that with us to see if we agree, because I think sometimes parents worry when we think they're doing great, but there are times when we see those signs pretty young. Then those mothers could draw their blood at that younger age to see if we're at more concern for their children. This is a private test. Insurance has not approved it yet because we're one of the pilot sites. It's very well researched. This is not an issue of whether the data is clear. It is. The data is very clear. It's very good research. But it's not covered by insurance. So the test is going to be around $800 to $900. And they have a testing cash system for that. And the blood draws are going to be drawn on the mothers. If you have more interest in this test and you want to make an appointment with me to discuss, or you want to arrange a blood draw with our staff, and we will probably have an appointment with that as well to discuss it, then call the office and we can help arrange that for you. I'm sure there's going to be lots of questions and lots of emotions around it, and we'll kind of take those as they come. Thanks, everyone.